This is Columbus Concerns, a public affairs presentation of North American Broadcasting. Here's your host, Mark News.
And good morning, and thanks so much for joining us today on Columbus Concerns. Well, we've all been watching that measles outbreak that has occurred in Texas and in the other southwestern United States. We saw well over 150 new cases of measles, and we also have seen 2 deaths so far, one in the state of Texas and one in New Mexico. And of course, we also know that measles was basically wiped out here in the United States back in the year 2000, but vaccination rates have gone down and measles is coming back. Now, last year, before school started, Dr. Bruce Vanderhoff, the head of the Ohio Department of Health, talked about the need for parents to get their kids immunized against measles and to make sure that their kindergarten-age kids were up to date on their inoculations. This, of course, as the rates of those vaccines have been going down among Ohio children. So here's Dr. Bruce Vanderhoff and his guest this morning on Columbus Concerns, talking about the need for kids to be immunized against measles.
And as the state's health director, one of my top priorities when talking about this time of year is to emphasize the importance of well child care and ensuring your children are staying up to date with recommended childhood vaccinations. Now, sometimes we may feel like these vaccines are for diseases of the past, diseases that are no longer relevant today. But all too often, we're encountering proof that this simply isn't true. We continue to see tragic cases of so many of these vaccine-preventable illnesses popping up right here in Ohio. Now, I've talked recently about measles cases in Ohio, and we've had 7 of them this year. Looking back just a little, we're not far removed from a sizable measles outbreak that happened here in Ohio in the fall of 2022. We also have had outbreaks of pertussis or whooping cough, meningococcal disease, and mumps. All of these diseases are covered by the recommended childhood vaccines. A lot of careful thought goes into the development of the recommended list of vaccines, and yet Ohio's rate of vaccination among our kindergartners, which is our best barometer of statewide childhood vaccination rates, fell slightly in the 2023-2024 school year. The percentage of kindergartners who are up to date on all the recommended vaccines slipped from 86.5% in the 22-23 school year to 86.2% this past school year. Now, that's a small drop, granted, but this comes on the heels of a rebound in rates between 21-22 and 22-23, which was really the first school year that we emerged from the pandemic. We were hopeful that rates would continue to rebound and perhaps get back soon to pre-pandemic levels, which were close to 90%, but that just hasn't happened. Now, this is not merely an Ohio phenomenon. Just last week, the CDC issued a call to action on this topic, stating that their data is showing that kindergarten vaccination rates have declined to their lowest level in decades across the nation. The call to action was to encourage state health departments and other public health agencies to do all we can to promote kindergarten vaccination readiness. ODH, of course, has ongoing outreach efforts, including provider-based education, grants to local health departments to promote vaccination, and we also work closely with the schools themselves through our school nursing program. But we also run regular communication campaigns to promote vaccination, and we're preparing a robust multimedia campaign for this fall, which will include radio and television ads, as well as social media posts. This is such an important topic for the health of Ohio, especially for the health of our youth. And no one could be more knowledgeable about vaccination or more recognized on this topic than the guest we are so privileged to have with us here today. Dr. Paul Offit is director of the Vaccine Education Center at Children's Hospital of Philadelphia and an internationally recognized expert in the fields of virology and immunology. He was a member of the Advisory Committee on Immunization Practices to the Centers for Disease Control and Prevention. He is a member of the Institute of Medicine and co-editor of the foremost vaccine text, Vaccines. Dr. Offit has published more than 150 papers in medical and scientific journals and is also the co-inventor of a landmark rotavirus vaccine that is credited with saving the lives of large numbers of infants worldwide. Dr. Offit, welcome.
Thank you. Thanks for asking me.
I mentioned that the CDC is launching a national campaign to improve kindergarten vaccination rates, as the decline in vaccination rates we've seen in Ohio is also happening nationally. What do you think is driving these declines, and what role did the pandemic play in this?
Well, the pandemic clearly played a big role. I mean, people were uncomfortable going to settings where there were groups of people gathered together indoors, and so immunization rates declined fairly dramatically. I mean, if you define pandemic as something that changes the way that we live, work, or play, I think you can argue that the pandemic is over, but the virus isn't over. So SARS-CoV-2 virus, the cause of COVID, will continue to circulate. And I think vaccines are largely a victim of their own success. People aren't afraid of these diseases anymore. And take measles, which is the perfect example, and one unfortunately you've had to experience in Ohio. This was a virus that we eliminated from the United States by the year 2000, which is to say that although the virus would occasionally be brought in from other countries where it was still circulating, we didn't see any spread from one American child to the next for at least a year. But measles is back. It's the most contagious of the vaccine preventable diseases, and therefore it is the canary in the coal mine. Whenever you see any sort of erosion in vaccine rates, it's measles that you see. And I think people forget measles. I mean, I'm a child of the 1950s, as you can see, because this is a video. I'm an old person. So, I mean, I had measles. Measles vaccine wasn't until 1963. But before that vaccine, every year there'd be 48,000 children who were hospitalized by measles, about 500 who would die from measles pneumonia or measles encephalitis, meaning inflammation of the brain or dehydration. Measles was a bad disease. People were scared of measles. And I think we're not as scared now, which is unfortunate. But I hope we don't have to remember this disease by seeing it again. And I think that's sort of where we're heading.
And just a reminder from state officials once again that all kindergarten-age children need to be up to date on their vaccinations here in Ohio as rates continue to go down. Also on Columbus Concerns this morning, portions of an interview we recently did with the head of the Prevent Blindness Ohio organization. With us is the president and CEO of Prevent Blindness Ohio, Amy Polis. And Amy, thanks for being here today.
Well, thanks for having us.
First of all, for those who don't know, what is Prevent Blindness Ohio?
So we are a statewide nonprofit organization. We serve all 88 counties in the state of Ohio, and our mission is to prevent blindness and preserve sight. So really is what we're doing is we are trying to stop vision loss before it happens so that people can maintain their independence, their quality of life, their ability to learn throughout their entire lifetime.
And for those who would like to look up more about the organization, what's your website address?
Yeah, our website is www.pbohio.org, and that's PB as in Prevent Blindness, Ohio.org.
That's an easy one to remember.
Yeah.
Talk a little bit about some of the programs you have. I know you have a program called Vision Care Outreach. What is that all about?
Yeah, so our Vision Care Outreach program, that is our social service program where if somebody is at 200% poverty or worse and they either do not have vision insurance or they are what we consider underinsured. A good example of being underinsured is through basic Medicaid. Some are able to get a comprehensive eye exam covered, but not their eyeglasses. Or some people's copays on their eyeglasses are just too expensive or just don't cover enough of the cost to where they can afford it, and then that's a barrier to them to care. So they are able to come to our Vision Care Outreach program, and we can get them access to a free eye exam and glasses. And we can do this within any of the 88 counties in Ohio.
How are people referred to you?
Yeah, so some people just call us directly, and we're able to serve them that way. But most of what we do through partner organizations. So we partner with almost 1,000 organizations across the state where we have gone into their locations. we have trained them to be able to do vision screenings on the people that they're already serving. For example, some local Goodwills, some food pantries, other local health departments, even some eye clinics, some health clinics. We go into them, we provide them with the training to do vision screenings, and then we also give them the equipment that they need to be able to conduct those vision screenings, as well as a questionnaire that they ask the people that they're already serving, a questionnaire about their vision, and any of number of things can red flag them and say, hey, you need to get into an eye doctor. Even just answering the question, when was your last eye exam? If it was more than 2 years ago, then that's a referral to vision care. And then they will be able to then say, okay, we can get you into this program if you're not able to afford that vision care. And then they send those clients directly to us.
Is this for adults and children?
Oh, yeah. We can serve people of all ages. We have great relationships with school nurses all across the state. Where they are aware that they can refer their students who are, having trouble seeing in class, and they know that the family's not able to afford, an eye exam and glasses. They can refer them to us, to our program.
Where does your funding come from for that?
Yeah, so for our vision care outreach, most of our funding comes from foundation grants. We get, about $500,000 a year from various different family foundations, corporate foundations, all across the state, community foundations. They will give us grants to help cover the cost of that, as well as special events. We hold 7 special events across the state each year that help to fund that program as well.
Talk a little bit about, the governor recently talked about in his budget proposal, bolstering a state program that would help kids who can't afford it to get eyeglasses. He said a lot of kids get the screening in school. They find out they need the glasses, but then they can't afford them. Talk a little bit about what's your position on that program?
Yeah, so shockingly, more than half the kids in Ohio who fail a vision screening at school. So, schools are required to conduct vision screenings on their students every other year, essentially all the way through the 11th grade. More than half of those kids that fail those vision screenings don't ever actually make it to an eye doctor. And there's multiple reasons why that is the case. But through this, Ohio C is the name of the program that the governor is proposing to establish through his budget. It would provide funding, grants to organizations that will be able to go into schools and actually conduct in-school eye exams. For example, there are some school districts that actually have health clinics right there on site. They have proven to be quite successful in helping to get children to health care who aren't otherwise receiving the necessary health care that they need. But this funding could help to support vision clinics within those health clinics at schools. Also, there could be grants available for organizations that will bring mobile vision clinics directly to the school, be able to kind of pull up, park in the parking lot, and any of the kids that had failed the vision screening would be able to come out and get an eye exam and glasses, as well as what we refer to as a roll-on, roll-off model. That's where eye doctors will bring their eye exam equipment right to the school, roll it off the van, set up in a spare classroom or some free space within the school, do the eye exams, and then roll out. And then also there will be grants available for organizations that would like to do care coordination, because in some cases across the state, the kids, it's as simple as educating the parents on okay, your child failed an eye exam. Here's what you do next. Here's the eye doctors that you can go to. Here's the eye doctors that accept your insurance, and then just doing that follow through with those parents, just to make sure that those kids are getting those eye exams. So this is a really great comprehensive program that Prevent Blindness is very excited to see. Our governor has always had a lot of children's initiatives. The health of children, safety of children has always been a huge priority for Governor DeWine. And we are just thrilled that he's, putting his money where his mouth is and trying to get these kids the eye exams that they need, because if a child can't see, they can't learn as well. And what we hear every single day that I go to work, we hear a parent tell us that they had no idea that their child was having trouble seeing until they found out that they failed their vision screening, because a child doesn't even realize it. They see what they believe, that what they see is how something really does look. And so it really is that failed vision screening that educates those parents and gets them to get their child to an eye doctor. So it's a great program. We are in full support, and we will be advocating for it all the way through to the finish line.
And in many cases, for some kids, the fact that they can't see is affecting their schoolwork.
Yes. Yep. It absolutely, 80% of what a child learns is through their eyesight. They can't see the board. They can't see the letters, in their books, impacts their ability to read. It can cause behavior problems that people are kind of misdiagnosing, not realizing that it's related to their vision. It's important when a child is on an IEP that they are getting their regular vision care, just so they can make sure that it's not eyesight that's hindering their ability to learn. So eye exams in children really are important.
Amy Paulus is here, and she is the president and CEO of Prevent Blindness Ohio. Again, the website address?
www.pbohio.org.
That's, like we said, easy one to remember. We talked a little bit about before we move on, let's just clear up one thing, at least when it comes to terms. What's the difference between a vision screening and a vision exam? Yeah.
So a vision screening is absolutely not a replacement for an eye exam. So when you go to the BMV to renew your driver's license, and you put your head inside that little machine and you tell them what's online for, that is, and just they say, okay, you passed that. That does not mean that you're not having trouble seeing or that you don't need to go to an eye doctor. A vision screening will just tell somebody, yeah, you are having trouble seeing. You're not seeing quite as good as you think you might be. You really should go into an eye doctor. But despite the results of your vision screening, we are huge proponents of people getting a regular comprehensive eye exam. That is when you go, you sit down in the chair, you do the, what's better, 1, 2, 3. But the other thing that they are doing in those eye exams is they're actually looking inside your eye. They're either dilating your eye, or they're taking a photo of the inside of your eye, so they can really see, they say that your eyes are sort of the window to the inside of your body, and there's a lot that they can learn about a patient by looking inside of their eyes. There are things that macular degeneration, cataracts, glaucoma, diabetic retinopathy. Oftentimes you hear of people, they went to the eye doctor and found out they had diabetes, or they had hypertension because of what the doctor was seeing inside of their eyes. But it is really important that an eye doctor actually look inside your eye regularly, just to make sure that your long-term eye health is good. And then if they spot any problems, they're able to detect those early and start to treat them when treatment is most successful, which can then prolong your ability to see for a lifetime. And in children, I can't say it enough. People think that, their kid sees fine, so they don't really need to take them to an eye doctor. And that's just not the case. You still should have a regular eye exam in children.
What age do you start with that?
Yeah, so we always encourage people to talk to their own eye doctor. That can vary depending on the eye doctor. So we encourage people to just ask their pediatrician what their advice is. See an eye doctor and ask their eye doctor how often they should bring their child, what age they should start.
Well, one of the things you mentioned, as we get older, of course, we can tend to have some vision problems, but it can also lead to more serious problems.
Yes.
Talk a little bit about the importance of older people still getting regular eye exams.
Yeah, so you can have a real loss of independence. As older people are losing their vision, they lose their ability to drive. Falls. Prevention is a big thing as far as eyesight. Many falls are caused by vision problems. So just making sure that you're wearing the glasses when you need to, and you're protecting your vision, doing what you need. But really, it also depression falls in line quite a bit with vision loss in older people because of a lack of independence, a lack of ability to drive, a lack of ability to take care of themselves. So, the longer we can see, even reading, we hear a lot about this from our aging clients that, reading, when they lost their ability to read, they couldn't see anymore. They couldn't do the crafts that they like to do, couldn't do the same things that they like to spend their time doing because they lost their eyesight, or their eyesight deteriorated enough that they weren't able to do those things. So that's what we're here for, to try to, really drive home the message of regular eye care so that any vision loss that you are going to, sustain, we push that off as far as we possibly can.
Well, talk a little bit about some of the mistakes that people make when it comes to their vision and maybe that can damage their vision.
Yeah, absolutely. Well, not going to the eye doctor regularly, but also not proper hand washing, like if you wear contacts, not washing your hands properly, getting infections in your eye, rubbing your eye, touching your eye with dirty hands can cause infections, and then those infections can then cause vision loss. Oftentimes, there are people who aren't able to see out of one eye. It's not uncommon at all for, especially in older people now, who had amblyopia as a child, and that is where one eye is weaker than the other one. And if that's not treated by around the age of 8 in children, then it will cause permanent vision loss in that weaker eye, and then not even a pair of glasses will allow someone to see out of that eye. So when you hear somebody say, "Oh, I'm blind in one eye. I've never been able to see out of that eye," then that's more often the case what happened. But then you got to remember, it's really important then to protect that other eye from a hit. We always say polycarbonate lenses. Make sure you're protecting your eyes with polycarbonate lenses. So if something a projectile were to come at it, you can protect that eye. As well as safe toys. We encourage people, when you're buying toys for kids, don't get toys with projectiles. Anything that can fly and hit them in the eye and cause damage. You can, scratch your cornea, the outside layer of your eye, and then that can cause vision loss as well.
Amy Polis is here, the president and CEO of Prevent Blindness Ohio. Do you have any programs for people who have vision loss?
Yeah, so we do. So our main mission really is to prevent the vision loss.
Right.
We do not provide low vision services. However, we are a big resource for people who need low vision resources. So we know everybody. All the other organizations, places where you can go all across the state to be able to learn how to live with low vision or vision loss. And so we are able to provide referrals to, and provide people with the guidance on here's where you need to go to get the services and products that you need.
I know a lot of organizations like yours have sort of a speakers bureau where you can send people out.
Yes.
Do you do that as well?
Yeah. So we have what we call Healthy Eyes Advocates. Those are people that we have trained. We have thousands of Healthy Eyes advocates all across the state, where we have trained them to be able to give educational presentations on all the various different things that can impact people's eyes as they age. All the various different aging eye diseases, again, macular degeneration, glaucoma, cataract, diabetic retinopathy, and so on, as well as falls prevention, basic eye health presentations. And then we also train them to be vision screeners, and we give them the equipment that they need to be able to do those vision screenings. We provide those to anybody in the state that would like to become a Healthy Eyes advocate. They can come to us and go through our training at no cost to them. And they get all the materials that they need to do these eye health presentations, as well as those vision screenings for free.
And
then they're able to, we get a lot of nursing home volunteers and employees, as well as, senior centers, local health departments. They usually come to us and want to be trained as Healthy Eyes advocates so that they can provide that service to the people that they serve.
Well, when I think eye screening, I think of that chart on the wall
Yeah.
with the letters
Yep.
on it.
Yep.
Talk a little bit about what goes into an actual eye screening.
Yeah, so an actual vision screening, you're right. The equipment that we are actually giving are those eye charts that you can hang on the wall, and you tell them, you cover up one eye, and you stand 10 feet away from the chart, and you read the various different lines. So that really is that's the vision screening method that we provide training on. But then there are also machines that they can buy. For example, the one that you use when you go to renew your driver's license. That's an actual machine. That particular machine, I think, costs about $5,000. So not everybody can afford to buy that. But that's a vision screening tool as well. There's also cameras that they can hold, like put right up directly to your eye, click a button, and it'll shoot out we'll say a prescription, but it's, when you go to the eye doctor and you look inside that thing and you see a hot air balloon out in the distance, and it comes into focus, out of focus, and then it snaps and then spits out a number. And that's kind of a starter prescription level that your eye doctor then will start with in a comprehensive eye exam, and then start the whole 1 or 2 better, 3 or 4 better, and so on. So there's various different vision screening tools, but it's important to remember that comprehensive eye exam is still the gold standard in vision care. The vision screening really helps to move up on someone's priority list to get to an eye exam, because they can think, oh, I don't need to go, I have no reason to go, I see fine, blah, blah, blah. Then they fill a vision screening and we say, hey, you need to get to an eye doctor. And they say, oh, okay, I didn't realize that. I'll go to the eye doctor. So that really is the intent of those vision screenings.
And some good information this morning on the show from Prevent Blindness Ohio. I'm Mark News. Thanks so much for joining us. We'll see you again next week for another edition of Columbus Concerns.
Thanks for listening to Columbus Concerns, a public affairs presentation of North American Broadcasting. You can send questions or comments about today's show to Columbus Concerns in care of this station, 1458 Dublin Road, Columbus 43215. Or email us at columbusconcerns@napcomedia.com.
Food. Our survival relies on it. Yet every day in central Ohio, nearly 1 million pounds of it enters the landfill. That's a lot of food, natural resources, and money being wasted. The meals on our plates require a lot of energy, water, and land to grow, harvest, and prepare. And we rely on a healthy planet to provide that. When we choose to throw food away, we're choosing to discard all the resources that were invested along the way, not to mention the money that's being tossed out. But together, we can make choices that make a difference in our community and protect our environment. In fact, there are a lot of small changes that we can each make to reduce our waste, like saving our leftovers, properly storing our food, and composting. Learn more about what you can do to reduce your food waste at home, at work, at school, and in your community at SaveMoreThanFood.org, a program of SWACO.
Retirement can be scary, but only if you're not prepared. That's why AARP created thisispretirement.org. Because unless you've already retired, you're in pretirement, and you still have time to plan. Learn about retirement savings options, potential tax breaks, and how you can build savings over time. Visit thisispretirement.org for free resources to help you customize your action plan and feel the retirement fear disappear. Brought to you by AARP and the Ad Council.
I'm Scarlett Johansson. My family relied on public assistance to help provide meals for us. These meals fueled my involvement in theater and the arts as a child, which fostered my love for acting. The Feeding America network of food banks helps millions of people put food on the table. You can join the movement to end hunger by donating, volunteering, and advocating. Because when people are fed, futures are nourished. Join the movement to end hunger at feedingamerica.org/actnow.
Brought to you by Feeding America and the Ad Council.
I'm Tiffany Haddish.
And I'm Marlon Wayans. African Americans are 3 times more likely to be diagnosed with pancreatic cancer than any other racial or ethnic group.
When you or someone you love is facing a pancreatic cancer diagnosis, access to cutting-edge treatment can help make long-term survival possible and improve future patient outcomes.
That's why Stand Up to Cancer and the Lustgarten Foundation have teamed up to bring over 30 pancreatic cancer clinical trials to those who need them.
Learning all you can about pancreatic cancer, including treatment options and what clinical trials are available, can give you or a loved one even more than hope. It can help make long-term survival possible.
For more information about the latest pancreatic cancer research and clinical trials near you, visit pancreaticcancercollective.org.